Okay. All right, so my name is Dan Salinas, and this is my shoulder eval. Okay, so Mr. Patterson, what brings you in today?
So I was lifting weights, so the coach has us doing our 1 rep maxes, and I was doing the bench press, and I tried to push up. So like I had the way I was pushing up, and I felt this really big pop and pain in my right shoulder. And like the weights fell on me, but like I had a spotter, so like I was taken care of. But I came right in here, so.
All right. So during your bench, what time did you feel that pop in your shoulder, that painful? Was it kind of going down all the way, or was it once you were down pushing back up?
It was right when I started to push up, so I kind of came down slowly, and I went to go, put all my effort into it and push up, and I just felt this.
So since then, what makes it feel any kind of better? Like I guess what causes pain for you? Mostly noticeably.
So like if I try to bring my arm in, it hurts a lot. Like if I try to bring my arm up, it really hurts. The only thing that really makes it better is just not to move it. So
okay. So generally you can kind of bring it back and forth and stuff.
I can move it back with this. I mean, it definitely is irritated.
But definitely when you're coming across the body, that right arm's coming across, or you're bringing your arm up a little bit, you felt.
Yeah, that's when it's like really bad.
Okay. All right. So then, can you describe that pain for me? You were saying it's painful.
Super sharp. Like
super sharp.
Just like it feels like someone's punching me in my shoulder.
Right when it happens.
It's really bad.
Okay. Is it pretty consistent, or since then, like?
Like it kind of just I can just like feel it right now. Like, but if I try to, it's when I mostly try to move it that it hurts.
Okay. Do you notice it kind of going anywhere else? Like, do you feel pain like down your arm? Do you feel it going around your back, your neck, or is it pretty localized in that front side?
No, it was like just in my chest. It was like my shoulder and chest area. Like,
okay.
It was just
good
like,
to know. All right. So then, can you describe that? Not describe. Can you put on that pain scale? 10 being like the worst pain you've ever felt in your life. Just imagine that, and then 0 being none, 1 being like not really anything at all.
I mean,
nail.
but between like feeling the pop and the bar fall on me, like I felt like it was like an 8 out of 10.
8 out of 10, pretty bad.
Yeah.
Okay.
Like
so how does it feel now as you're sitting here? You're saying it's still painful, kind of aching. You know what I mean?
Like as I was walking over here from the weight room, like it definitely went down a little bit. So like right now it's like a 4 out of 10. So definitely still painful.
It's still pretty painful. Okay. And then when did you hurt it exactly again?
It was probably like 5 or 10 minutes ago.
Okay. So from the history that I've taken, I suspect it to be either my differential diagnosis will be either anterior deltoid, pectoralis major or minor, possibly a rotator cuff somewhere in there. Those are going to be my differential diagnosis, and possibly possible sternal fracture. Bar hit his chest, and he had a pain across his chest. So we'll take a look, but that will be my differential diagnosis. So I'll go into my observation. Okay, so as I observe, he's holding his arm in, kind of supporting it a little bit. His shoulders are relatively equal. I would have asked the patient to take off his shirt at this point just to get a good look for any swollen coloration deformity. You definitely see kind of like a deformity into his axilla, his armpit a little bit, and possibly some ecchymosis. And just compared, it's pretty off. Yeah, so that'll be that. And then I go into my palpations. So I'll start with my bony palpation just to kind of knock some stuff out of the way. So I'm just going to start across here. Do you feel any pain here at your jugular notch? Your clavicle going across? AC joint pain at all? No? Nothing on the back side as I go across the scapula. It's fine. Quarter, inferior angle. I'm going to kind of go for the glenohumeral. Do you have any pain kind of as I go in here? Possibly on the front side?
Starting to, yeah.
Okay, so right there. Okay, so go in the middle deltoid, posterior deltoid. Any pain at all?
No, there's no really hurt back there.
Cool. Do you feel any pain if I kind of squeeze your arm, looking for the humerus? Anything going on there?
No.
No? Okay, I'm going to go back to the sternum, and I'm going to kind of go down. Do you feel any pain down the center there at all?
Not right there, no.
Not right there? Okay, good. So, and I'm going to go to his coracoid process. You have a pain here?
Yeah, it's
definitely fired.
Trying to get tender.
Okay, sounds good. Okay. So as pain as anterior deltoid, pain as let's go. Sorry, not his anterior deltoid, his anterior surface of his shoulder, bony structures. So where the coracoid process, where the pec minor inserts to, and the anterior surface of his humerus, where the pec major inserts. So then from there, I'm going to go to soft tissue palpation musculature. So I'm just going to start on the back side. Do you feel any pain up here on your trap at all? No. Going down to his supraspinalis, infraspinalis, teres, minor. Any pain there? No. Going over his deltoids, any pain there?
No.
On the front side here, do you have any pain? Okay. I'm going to go across his pec, pain.
Yeah,
definitely feel the deformity there. Going across on the lateral side of his sternum, do you have any pain there?
Yeah.
So positive signs, just palpating. You're definitely seeing a lot of positives for the pec major. Not too much rotator cuff, but we'll kind of look into that when we do range of motion and to do special tests. So when we do range of motion, so I'm going to ask him to do these actively. I'm going to have him do both arms just to see. So I'm going to have you start off with shoulder flexion. So we're going to bring your arms to your side. You're just going to raise them in front of you. How does that feel?
It's definitely painful.
Yeah. The other side's fine.
The other side's fine.
All right. So very painful. You're limited. Can't do it.
Yeah.
Okay. So then I'm going to have you kind of extend your arms back behind you. Any pain there?
I mean, it's uncomfortable, but it's not super painful.
Okay. Raise your arms to your side. About where do you feel pain at all?
No, that's
not too bad.
I mean, it's uncomfortable to move it, but it's not super painful.
Okay. So then I'm going to have you so then we just raise your arms out to your side. For abduction, we're going to bring your arm in now. Do you have any pain there?
Yeah, that's really
so really painful there. Other side, totally fine.
Yeah, the other side.
Cool. Okay, so then I'm going to ask you to raise your arms to your side. You said that was unpainful.
Yeah.
So I'm going to have you bring it back. Any pain there?
No.
No, nothing too bad. How about across? Can you do that at all?
No.
No,
that's like
not happening.
No, like once I get to here, I can't really go any farther forward.
Okay, sounds good. All right, so you can relax. So since he has pain during horizontal adduction and just simple adduction and shoulder flexion, I'm not going to necessarily put him through those passive range of motions. Those are pretty positive signs for pec. And so then I will do any kind of special testing right now. So I'm going to do just some to kind of knock out my initial differential diagnosis of so rotator cuff, anterior deltoid, and any sternal fracture stuff. So I'm going to have you try to do Neer's test. So I'm going to do your good side first. So I'm just going to bring your arm up here. Any pain there?
No.
Okay. So I'm going to do the same thing here. I'm going to move you. Any pain here?
No, not really.
Not really? Good.
A little bit uncomfortable, but...
Okay, so I'm going to raise your arms up above you. So we're going to do drop arm test. So now you're going to slowly lower your arms to your side. All the way down. No pain?
Just discomfort, but no.
Just discomfort around the right front side? Nothing? Yeah. There was nothing going on up in here at all, right?
It's not that pain. I was feeling those.
It's all in the front right there? Okay, good. So just knocking out some rotator cuff tears or anything like that with those tests. My diagnosis primarily, I would say, is that he has a pectoralis major strain and pec minor. What I would do with the deformity in his axilla pretty significant, I would say that we're going to refer him to a physician, get an MRI, and then we're going to possibly get surgery on that. I would imagine, depending on how severe the MRI results come back to be. And then we would set him up in a rehab plan and get his strength back, his range of motion back, try to get full function after he's had the surgery and recovers. And that will be my shoulder evaluation.
Sorry, I can't not.
Can't not clap.